Hi guys, welcome to my channel. It's Dr. B today again, helping you care for your mouth. So today we'll be talking about a very important topic, oral mouth odor, or halitosis, or in a layman's term, mouth odor. So I'll be using mouth odor more frequently because I want everybody that stumbles into my channel to understand, irrespective of where you're coming from. I wouldn't want a situation where because you're not a health personnel or because you're not a dentist, you couldn't get to understand the term I was using. No, let's use mouth odor. Some people can even jokingly say, this guy has BO. Oh my god, that's body odor. MO, mouth odor. So people use mnemonics like that to just describe it. So now, what are we talking about? Mouth odor. Mouth odor is unpleasant smell or odor coming out from the mouth, or sometimes nostrils. There's just unpleasant smell, unpleasant breath, or foul breath. So it can actually be coming from causes that are localized within the mouth or even the nose, but sometimes it could also be from distant organs, like systemic causes. So now I know that some people will be feeling like but I don't know, my mouth is smelling. Okay, this person said the mouth is smelling. This person is wrong. This person just hates me. While some others on their own, they've perceived it and they feel their mouth is smelling. Some know on their own that their mouth stinks, that the breath from their mouth stinks. Then when you put your hand over your mouth and try to breathe out, you can actually perceive it to know how good or bad your breath is. Some other people have to be told by people, maybe their colleagues in the office or their family members, people they live with. Some of them, it has to be their spouse or their dates, that we have to tell them that your mouth stinks or you have a foul breath, depending on how pleasing the person is able to put it. So now some people perceived it on their own, while some other people were told by others. Then both of them is the case. They've perceived it. Some have even got to the extent of doing a lot of things to control the smell, but they've not been able to do anything. Now, stop trying to treat it on your own. See a dentist. That's why I'm here for you. It can affect any age. So I've seen children with mouth odor, real bad mouth odor. Children, adults, it can affect any age. So as parents, you should also try to know when your child talks to you, if you perceive foul breath, try and make sure that your child sees a dentist, especially if the foul breath is present even on days you are sure that my child has brushed today and this is still present. Make sure you try to take your child to see the dentist. Let's not ignore some things. Some things are not meant to be ignored. Then some other people feel, it's a family thing. It's in the family. My father had it. My mother. Please. Don't do that. Take yourself to, in fact, just go to a dental clinic and see a dentist. So there are various causes of mouth odor. Sometimes it could be from your cleaning technique. Maybe you're not cleaning your mouth well. See my video on teeth cleaning. If you're not cleaning your mouth well, you're not brushing well, you're not brushing your tongue and all that, you can have mouth odor. Yes, you can have mouth odor if you're not brushing your tongue well. If you're not brushing your teeth well, you can have mouth odor. Now, some other people, it is not even, some people brush so well that, in fact, they call it overzealous teeth brushing. They brush so well. Some of them, their teeth has even started to wear down from using hard toothbrush, and they are brushing with so much strength. No. Don't overstress yourself. Go and see a dentist. Stop doing the work meant for another person. Go and see a dentist. Don't stress yourself. You're just suffering in vain. Do not try to suffer in vain. Now, sometimes it's not even about depression. Sometimes you have deposit like plaques and calculus in your teeth that has to be professionally removed from professional cleaning before you can be free from oral mouth odor, because those things just keep discharging foul odor in your mouth. Please go and see a dentist. Then sometimes it's the diet, it's what you eat. Sometimes it is what you eat. Some people, they have the habit of chewing garlic, ginger, or taking ginger or garlic tea and all that. So when they decompose, they release those gases that are foul smelling, and then you have this peculiar odor. Yes, so you may have to discontinue all that. So now we'll be talking also about other causes, like it could be systemic causes. It could be diabetes, it could be some gastrointestinal issues, but that's not meant for the layman to go into. It could also be from the respiratory tract. It could be from anywhere. It could even be from the throat, not even like it's actually so far-fetched. But most times it's usually localized, like around your mouth, your nose, your sinuses and all that. The causes can just be localized like that. Sometimes it could just be coming from a distant organ, indicating that something is going on somewhere. That is why you need to see a dentist. You need to see a dentist to be able to identify. Sometimes the first time people get diagnosed of systemic conditions is because they presented to the dentist for mouth odor, and then we are like, this one is peculiar, this one is like this is that. I wouldn't want to be going all into all that. Like I said, this video is going to be a video that even a layman can understand, but it could just be your first point for diagnosing something that is killing your organs somewhere and you are not aware of. Okay, so there are various effects that mouth odor can cause on people. You think, it's not just mouth odor. It's a lie. People have had to end relationships because of mouth odor. Some people are withdrawn socially. Some people do not even go to public gatherings. Some don't make friends much because they don't want more people to tell them that they have mouth odor. Some of them in public places, they don't speak out. They can't talk. When they want to talk, some of them will close their mouth. They'll just be talking in a very low tone. And you think, this person is shy, this person is timid. But that's not really the case. Something is causing that shy and withdrawal for them is actually despair. They know that when they open their mouth wide to talk, people will feel, people will just repulsive, people will withdraw. So that's why some of them begin to isolate themselves. It can cause depression, especially for those that do not know that it can be managed. Please, mouth odor can be managed. See your dentist. It can be managed. Don't kill yourself. Don't over try home remedies. Don't just bother yourself. Just see a dental visit can turn your life around. Some even go to the extent of doing overzealous teeth brushing. So we start changing and trying different types of toothpaste, spending so much money for something that can easily be managed. It can get so bad that some people will be doing overzealous teeth brushing. They will be so zealous, use so much force with hard toothbrush, and they start to wear down their teeth and they start having sensitive teeth. So in a bit to manage mouth odor, you have moved yourself into sensitivity. So let's try as much as possible to present to a dental clinic if you feel you have mouth odor. So it has made them to have low self-esteem. I've had patients that had to end relationships because of mouth odor. So don't ditch that guy or that lady because of mouth odor. It can be managed. Oh my God, I've been sat close to that guy. Please, it's not that bad. It's not that serious. It's not that deep. Just bring him to a dental clinic to see a dentist. Don't lose your missing rib because of mouth odor. Please bring that person to see a dentist, and it will be a thing of the past. So apart from the fact that you solve the issue of mouth odor, you might just be diagnosing something in some other part of your body. So try and see your dentist. So guys, do not forget to click the like button, subscribe to my channel, and turn on your notification so that you get more juicy information on your dental health. Bye.